This one is interesting. Another family leaving the hospital, wanting to go to a nursing home. They reach out to me and they say, Henry, how can you help? I said, what's the problem? I said, well, dad has Medicaid, dad has Medicare. I said, well, yeah, normally in most cases, a nursing home would take that person if you're looking for long-term care or rehab. They said, we don't know the difference. I said, well, what are you looking to do? He said, well, he needs somewhere to go live. I said, that's long-term care nursing home, right? Got a question for you though. I said, what is this? Do you have any life insurance? He says, yeah, we have a small life insurance policy that, he's been paying on for years. And I said, I have to be honest with you since you called me because I have to do this, right? They always put me in the mode of being the guy to break the bad news. And by the way, everyone knows the news. They just put me in the mode of being the one to break the bad news, but it's okay. I like being precious, man. And so today I had to tell them that because of this life insurance policy, you will not be able to go into that facility or let me be very clear, you will lose the surrender value of said policy. They said, that's unbelievable. I said, this is how this works. And, unfortunately, people don't talk about it enough. You can't have more than like $2,000 in assets, which means you can't own a house. Assets, total assets. Remember that. This life insurance policy is an asset. It has a cash surrender value, and that value changes from day to day. And so whatever that value is, if it's over a certain threshold, you have to surrender that to the nursing home. And they say, well, how am I going to bury him? And that is my grief with this program and policy that's been set in place. It sets up a certain number of people, certain classes of people to work their entire lives, to then have to give up their homes, their life insurance policies, or, and I'm going to say this, or make their kids take care of them. And in this economy, that's no longer an option. Now, I would say this because I like to be fair. Even 10 years ago, I could see this working out, right? When I first started the hospice at Precious Hospice, I saw things and I said, this makes sense. I can make this work, right? Today, the cost, right? It's not working. It's not working. These people are living longer and their kids are having kids. So now you got that sandwich generation, which is that middle person there, like a sandwich with the 2 pieces of bread on top. And they're having to take care of their loved ones that are seniors, their parents, and their kids at the same time. They can't do that and go to work. They need both incomes. It's not like this model, again, it worked 10 years ago, 20 years ago, 30 years ago. You can live off one income. Today, people are not able to sustain on one income, not a whole family. It's just not working. And the other thing that I'm going to say, because it's important that we say this, people have to start speaking up because if the truth is not put out there, people won't know. And then they'll wait until this situation happens. Then they got to make some hard decisions. Now, prayerfully, because of Precious Hospice, thank you, we're able to get the patient home. And they were able to find someone who can live in the home with the father during his comfort phase. But however, most people don't have that. Most people don't have that. And unfortunately, it's one of those situations where I did reach out to a family structured care program. I did reach out to a Medicaid home care program. And because everything's so backed up, they can't even get them pushed through Source and CCSP for 4 months, they thought. Why is it like this? This is a hospice patient coming from the hospital. In 4 months, there's no telling where he would be. So my advice to you today, start planning for your inevitable now. Don't wait. Don't put it all on your kids. Figure that out. If you know you want to be at home and be comfortable, put that in there. If you know you're okay with going to a facility, put that in there. And I want to differentiate briefly facility and nursing home. You all say, I don't want to put my loved one in a facility. Normally what you mean is, I don't want to put them in a nursing home, but you don't want to put them in a place that's paid for by Medicaid and Medicare. When it comes to a facility, private pay, an assisted living facility, memory care facility, those are normally much nicer places. And I say normally, not all the times, and they're out of pocket. So they're competing with other companies. Whereas nursing homes, they just take insurance and there's not a new nursing home being built every day. That's my take on today. And I just really love y'all and wanted to get that out there.